This is Dr. Steve with Rockwall CPR. Let's talk about BLS, basic life support, and some of the additional things that a healthcare professional must know. One of the things I find that most are not aware of is something called left uterine displacement. Here's a paper from 2022, Effect of Maternal Positioning During Cardiopulmonary Resuscitation. So, what are we looking at here? Well, let's scroll down and go right to what I have highlighted. Aortocaval compression. So that means as the mother's belly is getting larger, there's going to be a compression that occurs at the aorta and the inferior vena cava, which decreases cardiac output. So what does this say? Aortocaval compression occurs beginning around 20 weeks of gestation, when the growth of the uteroplacental unit compresses the aorta, inferior vena cava, or both in the supine position, supine being on your back. Such compression can reduce cardiac output by as much as 30 to 40%. During CPR, manual chest compressions could produce approximately 30% of the normal cardiac output in a non-pregnant situation. Aortocaval compression in late pregnancy further reduces cardiac output to around 10% of the non-pregnant cardiac output. So again, as mom's belly gets larger and larger, there's compression decreasing cardiac output. So what do we need to do in that situation? We need to do what is called left uterine displacement. There's a two-hand technique, which you see on the left, and a one-hand technique. The bottom line is one person's sole responsibility is to pull that belly to the left while everybody else is doing their thing, meaning somebody's doing compression, at least one other person is doing the breathing with a bag valve mask, an ambu bag. Very, very important. So if you are a health professional, especially outside the hospital, here at Rockwall CPR, we mostly teach health professionals outside the hospital. What we find is offices don't have an ambu bag and are not prepared for, God forbid, a pregnant woman having a sudden cardiac arrest. So learn a little bit more about left uterine displacement. I placed a link to the paper in the notes. Very, very important. Contact us for your recertifications, rockwallcpr.com.